There we go.
Okay, Dr. Shazian, what did you do?
Okay,
What you
so this patient is a 64-year-old female here for follow-up hypertension and diabetes.
Okay.
She needs to be like medically cleared prior to a vaginal repair surgery.
Okay.
So her blood pressure, she was seen 2 weeks ago, her blood pressure was elevated.
Okay.
So we increased her valsartan from 40 to 80 milligrams daily, but her blood pressure is still elevated today. It was 172/97 initially, and then 155/90 on repeat 20 minits later.
Okay.
She's only on valsartan 80 milligrams daily. She has some nausea during the day and some headaches, occipitally located headaches as well.
Okay.
With the hypertension.
Okay.
And would like some ibuprofen for her headaches. For her, she has an appointment with the cardiologist tomorrow.
Okay.
Just for cardiac clearance in general for the surgery, but obviously for the hypertension as well.
Okay.
For her diabetes, her last A1C, which was done at her last visit, was 6.2.
Okay.
She's on metformin 500 milligrams XR every morning, as well as atorvastatin 40 milligrams daily.
Okay.
Her weight today is like 2 pounds heavier than her last visit. After her diet, she tries to cut down on sugar, has cut down on the number of tortillas that she's eating, and generally healthy, only eats home food. Walks around her house for about an hour a day. It's she has some difficulty with the rectocele and that she's dealing with, but she's getting a pessary placed on the 13th. So hopefully that'll help with her activity level. We also did a retinopathy screening at the last visit, and it came back normal bilaterally.
Perfect. So let me ask you a few questions. So based upon this, this is a pre-operative evaluation. Okay.
Well, not really. More like follow-up blood pressure.
Oh, okay.
Yeah.
Okay. When is her surgery scheduled?
They haven't even scheduled it. They want to see what cardiology says first, and they
Okay.
want her blood pressure controlled.
So you'll place lab orders based upon that. So not today. Okay, perfect. So based upon her blood pressure control, would you call it hypertensive urgency or emergency, or you think it's chronic hypertension?
I think it's chronic hypertension.
Okay, because when it's
She has symptoms though.
Mm-hmm.
But it's chronically happening.
It's chronically happening.
Yes.
Right. So hypertensive urgency is when the blood pressure is over 180 over 120.
Right.
So that she's not there.
Yeah.
And emergency is when there is end organ damage.
Right.
So it's not there. So
exactly.
we can say it's chronic uncontrolled hypertension.
Yeah.
So are you considering a second agent?
So so we tried increasing the monotherapy, and that clearly didn't work. So I wanted to add a calcium channel blocker in addition to it, because it was either that or a thiazide, and I just didn't think a thiazide, there was a study up to date that showed that a calcium channel blocker would be better with an ARB. So I was between just adding the amlodipine versus doing a combo amlodipine valsartan, just so she doesn't have to take as many pills.
Okay, so I'll say a couple of things here. One thing is that with chronic uncontrolled hypertension, it's sometimes better to add a second agent before maximizing the dose for the first one. So that's a good thought. But then also chlorthalidone, which is it has that diuretic, has been shown to be more effective than the calcium channel blockers or other agents, or even hydrochlorothiazide. So you might want to add that
instead of amlodipine,
unless she has a contraindication. Because with the amlodipine,
she doesn't have edema.
Yeah, so with amlodipine, we do see some lower extremity edema sometimes. So especially in patients with diabetes. So it's probably better just to add chlorthalidone, but I am open to both options. I think they're both reasonable.
Do they have a combo chlorthalidone? I just like to not make the changes.
Take so many meds, yeah. Well, in the beginning, start with a low dose chlorthalidone, because you don't know what dose she's going to be optimal at. And then for diabetes, would you consider adding anything or continuing the same?
I would continue the same. Her A1C is 6.2. She's been really good with her diet. I'm not worried about it.
That's great. So, great. And you've done you've addressed all the preventative screening tests also. She's up to date on a mammogram and her pap smears and colonoscopy.
Well, she doesn't need
she's post-hysterectomy or?
Wait, I think I did a pap.
Okay. So yeah, as long as she's up to date, yeah, we can always check. And then mammogram and colonoscopy, she's up to date on that. Okay. So those are just the things to address. But I think as far as her chronic disease management is concerned, I think
That is fine. Yeah.
your plan is right on. That's great.
Thank you.
All right. Thank you.
Mhm.